Hello and welcome back to this edition of Bayou Time. Again, your host, Keith Weisheit, licensed clinical social worker. So very glad you are joining us. We appreciate it very, very much. And you know, we always like to go to the source when it comes to dealing with some of the things in our community. Best way to do that, especially in the medical community, is deal with our new doctors. Dr. Ugo, welcome to the show and welcome to our area. We're so very glad to have you.
Thank you. Thank you so very much. It's a pleasure and an honor to be here.
We appreciate it. And as a pulmonologist and a critical care pulmonologist, we know you deal with so many things. Tell us a little bit about yourself and what brought you here.
Yeah, of course. I'm Dr. Ugo Ezema. I go by Dr. Ugo. It's easier for everybody else.
Sure.
I'm a critical care, like you said, critical care and pulmonologist. Pulmonologist dealing mostly with the lungs, and critical care dealing mostly with our patients that come into the ICU by whatever means. I've been here now for the better part of 2 years, happily so,
Right.
and trained at Tulane. I'm originally from Nigeria by way of Jamaica. I went to Nicholls State, go Colonels.
Absolutely.
And,
Graduate as well.
And I've been around since then, and this is my home now.
I love it. I love it. We're certainly very glad to have you here. And I know you mentioned some of the things. What are some of the things that you're treating, some of those pulmonary diseases that you see in the clinic?
Absolutely. The most common things, asthma, COPD, interstitial lung diseases, lung fibrosis, pulmonary fibrosis. And we help to diagnose and treat a little bit of lung cancer as well. So certainly on the diagnosis part. And a big part of what we do is also education and helping our patients kind of manage and go through these disease processes and preventative care in stopping these diseases from getting worse,
Right.
and certainly from beginning in the first place, bringing up things like smoking education or smoking cessation,
Right.
and things of that nature.
Well, and speaking of, some of us are dealing with some external smoke. We've got one of these shots here that we'd like to show people what we're dealing with here in our area with the Marsh fire. This is a rather remarkable aerial view, and this was taken this morning of this particular shot. And so this was taken on Thursday morning. And so that's a large volume of smoke coming from these marsh fires. Can we just kind of talk a little bit about how it impacts people with respiratory issues?
Yeah, so marsh fires, just like almost any other type of inhalant, anything that goes into your lungs that's not supposed to be there, has a large component of very, very different things. Most of them are noxious, so poisonous. Whatever is being burnt is being turned into small particles that can go deep into your lungs and cause all sorts of problems, none the least of which inflammation, mucus, causing shortness of breath, cough, wheezing. And these particles, when they're small enough, can have manifestations outside of your lungs as well.
Okay.
Eye irritation, headaches, sore throat, sinus issues, and all of these problems altogether can lead to exacerbations of your underlying lung disease if you have an underlying lung disease.
Right,
So our patients that have COPD, that have asthma, interstitial lung diseases that we spoke about earlier,
Right.
these little particles that go into your lungs can make those conditions worse. And so really, this is going to be a problem for us until we're able to kind of get a good grasp on managing our patients and certainly preventing our patients from having those exposures.
Right.
So this is going to be a big problem for us as a community and certainly as a practice.
Yeah. So what do people who have some of those underlying conditions, what can they do? Do they need to just truly try and avoid these areas completely?
100%.
Okay.
And I know it's easier said than done.
Right.
A lot of these areas are on our way to work. I experienced
Much like
that.
yourself, right?
Exactly. I experienced that this morning.
Right.
So it's going to be very challenging, but there are ways that we can go about avoiding these things to the best of our abilities. If you're home and the marsh fires are around your home, try to keep your house as locked as possible.
Right.
You can get air purifiers. If particularly in this case, you should probably get the high efficiency particulate air purifier, HEPA filters.
Right.
Those are very, very good for helping to clean the air in your home. If you're in your car, you can use the AC button that recirculates clean
in the
air.
car.
So that's a good option too.
Right.
Your standard masks probably don't protect you as well, because some of those finer particles can still get in, but it doesn't hurt. So,
Right, to wear a mask.
Exactly. It doesn't hurt to wear a mask when you know you're going to be in that kind of exposure.
Okay.
And of course, doing all the other things that you do for your disease process. So
Right.
taking all your medications on time.
Right. And following doctor's orders.
And following doctor's orders, yes.
Very
Providers' orders.
Right. Now, any long-term effects or impacts that some people may have to these marsh fires? I know we mentioned some with the conditions that they have underlying, but can people have some long-term results from this?
Yes. So
wow.
a lot of things, outside of marsh fires, but in general, the way you can get long-term manifestations and even short-term manifestations from anything that's inhaled into your lung is dependent on the dose. So how much of said insult and the timing, how long you've been having this exposure, the duration, exactly.
Right.
In particular, for these marsh fires, what can happen in a short term is if you get a high dosage or high exposure in a short amount of time, or if this continues for a long time, I can foresee that the over time you can have some long-term manifestations. The interstitial lung disease, which is just inflammation leading to scarring in the lung. So that can be something that we hear about our patients down the line in a few months, in a few years, about how that's happening. But in the short term, certainly you can have the exacerbations that we spoke about, and even people that don't have any underlying lung disease or underlying lung problems can have manifestations of new onset lung problems as well. Yeah.
Well, Dr. Hugo, we thank you so very much for your time, and we want to let people know that anytime they have any questions about problems they're having breathing, any issues, to go and call you guys. They can reach y'all at 985-850-6090, or you can visit tghealthsystem.com, and we always want to reach out to you. We thank you for your time today.
Thank you so much. It's my pleasure.
All right, Dr. Yule. All right, guys, that'll do it for this particular segment. Don't go anywhere. A whole lot more right here on Bayou Time.